everybody. We are live. It's Friday, the 10th of May, and I'm so excited because we're going to be talking about a new emerging technology today that could change the face of nursing. Yes, that's virtual nursing, and I'm going to be looking particularly at a case study of ChristianaCare and how they expanded their virtual nursing to 41% of beds to lower burnout. Before I begin, just want to make clear I'm not sponsored by ChristianaCare and I don't work for them. But I did think it was interesting what they're doing in this space, and I wanted to bring that to a wider audience. So today I'm going to talk about what they've achieved, what virtual nursing actually is, how they've done it, and then give a little bit of an analysis, if I can get my correct slides up, about how this could change the face of nurse recruitment and retention. Will it make it easier? Will it make it harder? Let's find out. So I'm going to begin by going over a little bit about what virtual nursing is and what it isn't, if you're not aware. So virtual nursing is, as you can see on the screen, the incorporation of digital technologies in order to streamline and create greater efficiency in the care that nurses can provide to patients. That could be on the number of patients that one nurse can care for, it can be the speed of work, or the level and quality of care that nurses can provide. You can see a few of the methods here, and this really took off whenever the pandemic struck. And we've seen in the last few years facilities start to embrace technology in ways that they hadn't done before COVID-19. Today, and what ChristianaCare done is not at the home setting. You can see here, this is called a virtual ward, where the patient is discharged from hospital and then through wearable technologies, you can see, for example, that's a heart rate, oxygen monitor on her finger. And on a video call, they're able to be tracked and assessed from a remote location. You also have these little robot nurses or physicians where it runs or rolls into the room, and the doctor or nurse is on the screen and able to communicate with the nurse. And you've also seen dancing robots in the care homes as well. That's not what ChristianaCare have done. What they have implemented is a system which is sort of what I would call camera-based, whereby in a patient's room, care can be delivered remotely through an experienced nurse who's in a digital command center in a different campus. They can monitor the patient. If the patient presses a call button, they can pop up on the screen and have a conversation with them. I'm going to share a video that will explain a little bit more on what they've done, and then we can go into a few more of the details. So here's the video. It should play for us all. If not, I'll make it play myself. So here we go.
Hi, good morning.
Hi there.
Hi, Mr. Glick. How are you?
Good morning, Melanie. How are you?
My name is Melanie, and I'm a ChristianaCare virtual nurse.
Virtual acute care nursing is a program whereby we have taken clinical bedside nurses out of the direct rotation on the unit of clinical care, and they're housed in a separate location within our campus. The virtual nurses use a bidirectional audiovisual tablet that connects them directly into the room of each of the patients that they're covering.
The connection was fast. The nurse was right on there, and she was already versed in my situation, so it made the conversation a lot easier.
I'm an extra resource. I can help with documentation, communication. We monitor vital signs. We monitor labs. The biggest things are keeping patients safe and getting them discharged on time.
We've set it up to the patients that this is another asset. It's another tool to make sure that we care for you with love and excellence from start to finish.
We understand what the patients need. We understand what the staff needs. And we just want to do whatever we can to take the best possible care of the patients.
This place is aces. I would never send anybody anywhere else.
So there you go. They're using it to really augment and improve the care that their nurses are able to provide. And I thought it was quite interesting the way the patient there was happy with the service, because I've seen other comments online, and I know myself maybe a bit reluctant to use new technologies, particularly whenever it comes to healthcare. I remember when self-checkouts came into the supermarket, I was a complete Luddite, and I wasn't I wasn't using them for the first 2 weeks. But you can see if ChristianaCare, the patient here at least, and is happy, and I haven't seen any other kind of journalistic inquiries or people complaining about it. So you can see in the context, it's for remote care delivery for that nurse who was interviewed, could provide health consultations, educate the patients, on-go care management. Also in the monitoring and follow-up. So once that patient leaves, using wearables, he can be tracked, just to make sure that everything's right on the vital signs. And also that nurse can coach and advise perhaps less experienced nurses or new grads who are on the ward physically with any questions that they may have or need support. If you saw, the little camera would go up to the patient and it could just be pressed, and then at that point you have somebody. So just that's the video. Let's get on. We've got a couple of comments from leaders that I asked for to input on how they see their facility utilizing this. Michael Tortoro from Baylor Scott & White in Texas said there's so many ways virtual nursing can be utilized. Discharge teaching is critical and takes so much time away from the floor nurses who are getting admissions, dealing with emergencies, and buried in paperwork. Having a third party could do that virtually. We also spend millions on sitters. If virtual tech monitoring patients could alert the floor nurse when assist is needed. And how about we do wellness teaching or educate patients on their chronic diseases virtually to reduce expense of travel to patient homes in order to keep patients out of ERs. Sure, just a few ideas. And as you saw in the video, ChristianaCare have adopted a couple of those, particularly in the education side to the patient. Here are the numbers which they are reporting. So if you look at the blue line, that is for patients who are receiving medical care, and then the orange is for patients receiving surgical care. The orange took a slight jump up from around 53% happy with or able to discuss patient care to 63%. But look at that one, the medical, it's really jumped up from about 13% to 60%. There's been a gigantic jump in the quantity of patients that are able to discuss care at the bedside. And if you've ever been in a hospital, I'm sure you've seen that a lot of facilities are really short-staffed, and not just in the ER, but in the wards as well. It's often difficult for patients to get people to come in and speak to them and discuss their care, particularly if there isn't a call system, or on that day, there's particular short staffing. And those dramatic jumps, I think, are something that can only really be achieved by innovative technology like this. That's almost a 5-fold increase in the number of people that are able to discuss care at the bedside of those looking after them. So I also spoke to a hospital recruitment director in Canada, in Ontario. He said they've worked through some issues of virtual care. Unions get a little on edge. Virtual monitoring of patients and workload and license protection are always a concern. So that really brings us on to the focal point of today's discussion is, what does it mean for nurse recruitment and retention? In the context of ChristianaCare, we don't yet have figures on if this is improving or maintaining or worsening their recruitment and retention situation, although they do say that they haven't needed to hire anybody new. So that 5-fold increase has come from their existing staff. So that's a big jump in quality that's came from not hiring additional nurses. And I think as time goes on, everybody in the sector needs to realize that recruiting and retaining more nurses isn't going to cut it to provide patients the quality of care that they're accustomed to. Only yesterday, I came across a projection from 2012 that forecast the change in RN supply to outpace demand, which, as we know, just isn't the case. They expected RN supply to grow by almost 1 million full-time nurses, and the demand to grow by 600,000. If you go onto my LinkedIn, you'll check out the numbers of the actual results, but there's a several 100,000 gap. So we really do have to look for other ways outside of improving recruitment and retention, because this has been tried for the past couple of decades, particularly. There's a widening gap with an aging population and an aging nursing population, and then the number of nurses coming in to the profession. I think an interesting comment on this is the actual per capita number of nurses since the 1980s has doubled, but also the number of people over 65 has doubled too. So we're kind of charting each other there. The system has been better at outputting staff, but getting enough people to care for the greater number of elderly is kind of outstripping that supply. So we have to do something new, have to do something different. And I looked at Regis College's definition of nurse responsibilities. When it comes to virtual nursing, green is those responsibilities that it can mostly take over with efficiency and effectiveness. Yellow is ones it can assist in, and then red are the areas I see where it would be quite difficult for virtual nursing to input. So about half are green and yellow, and green points are assessing, observing, and speaking to patients, and then educating patients and family members on treatment plans. Having spoken to a few nurses and looking online for their workload, I think number one, assessing, observing, speaking to patients about issues that often are really important with their treatment plan outcomes, but then also sometimes are not real medical emergencies, is an area that this could really come into play and help. The ability for floor nurses to focus on situations of high medical need, and then lower situations where an explanation is required, or a piece of advice, or just a simple kind word. It can be facilitated by a virtual nurse is a great opportunity. And then also on the education side, many experienced nurses that I work with do have sore feet, so to speak. They want to transition away from the bedside, and it's an ideal role really for an experienced nurse to do, whereby they can come in and with that authority tell the patients verbally the treatment plan is. They can have it up on their screen, and they don't actually need to be physically there to do it. And on an aside, that having a virtual nursing program is a big attraction for recruiting, lightening the workload of bedside nurses on the floor, and then also those jobs themselves. I can imagine would be popular because they earn a good nursing salary, say 80 grand plus, but then also have the ability to be sat to sort of at your desk doing it. Now, here are some of the changes that I foresee coming into play, and one that we have to be careful about, and the director in the Canadian hospital noted on that, was the increased ratios for bedside nurses. You can can see unions get a little iffy when it comes to the patients, especially technology messing up as it does, and then workload and license protection. There is, I think, a possibility for this to be negatively interpreted amongst nurses as corporate profiteering and pushing an unwanted technology onto staff in order to increase the number that bedside nurses would be caring for. So instead of 5 on the ward, it'd be 7 plus a virtual nurse. And it's really important if we see the adoption of this, if your facility's considering it, to communicate this in a way where nurses know that it's for their benefit and it's not all about cutting or streamlining. It's about augmenting and improving and aiding staff. As we saw in another quote, that reduction in spend on sitters is an opportunity where this can come in, because say you have 10 rooms, those rooms are all occupied by a sitter, for example. You could have one nurse who only needs to respond to changes in people's behavior via camera or the vital signs or whenever the call button is pressed. And again, that's something that can help nurses too, because they know that there's a nurse on the other end of that observation, someone that has their degree, rather than a sitter who may not be as qualified as them in the nursing field. As I mentioned, it's an attractive point for potential candidates, and then communicating well and doing it right can improve retention. What are the downsides? What are the potential dangers I see for this? Well, as I mentioned, the first one could be a communication gap, where your marketing team, your HR team, whoever's putting it out, doesn't accurately frame what this actually is and how it benefits nurses. You don't want people to feel pushed out by technology or that their jobs are being automated. That would have a reverse effect. So it's crucial to communicate the advantages for staff and patients in this, just like ChristianaCare are doing. And then, as we touched upon, if you're in a unionized facility, there's going to have to be even greater communication and probable negotiation, because they are typically going to be defensive over labor against technology. So that's something to consider as well as you look into it. We have a CEO in another Ontario hospital. He says, "We don't think the way out of healthcare recruitment crisis is better recruiting or retaining, even though we must do both to be competitive. We also can't solve the capacity crisis by building bigger hospitals, going down a path of hospital in the home to solve both crises. Most hospital home programs have been timid. We want to see what a robust approach looks like." So ChristianaCare, as far as I'm aware, in their case studies, they've been focusing on care in the ward. But if you look back on the communication figures as well, the 5-fold increase is something that they're particularly proud of. I've got a few other metrics that I'll go into for ChristianaCare, so that you can all get a full picture of what they've achieved if you're considering this for your organization. So they say they've achieved 39 minutes saved per day per nurse. That's something that the virtual nurses are picking up. In 2 years, they expanded it to 41% beds, and they're adding it to 400 more beds by September this year. That's including cardiac step downs. So a lot of proactive monitoring is needed there, and also pediatrics, where an additional challenge will be presented by having children on the other end of the camera with all their fun and energy. So I'm interested to see how it works out in the pediatric space. Once selected, virtual nurses are trained on the tech and asked to commit at least 2 shifts per day to virtual nursing. And they work in a center, so it's across from the hospitals. campus. So they will be able to go to the ward if they need to, but not in the course of their work as a virtual nurse. If you want to find out more about what ChristianaCare have done, there's a lot of information out online. I think they have used this as a marketing tool and are quite proactive in talking about it, which shows that they think it could be a draw for particular patients. I think that across the spectrum of the nursing shortage, there isn't a great need for new technology like this. But at the same time, there's a few other things that can be fixed urgently in order to actually complete the supply of nurses who will be physically by the bedside. So for example, the AICN reports that nursing schools had to limit their enrollments in the 2021 to 2022 school year, turning away nearly 92,000 qualified applicants. So that's almost 1 million nurses every decade that could have been trained, potentially, but they weren't because of nurse educator shortages. Here's a graph showing how that has risen by a negligible amount in 2002 to 2022. And then here are the pay bands for each of the main nursing professions and nurse educators. If you look in 2019, 5 years ago, the median nurse educator pay was 74,600. In 2023, it's 80,780. That's an 8% increase. All post-secondary teachers, meanwhile, were 68,970 in 2019, and that's increased by 22% to 84,380. So almost a 3-time greater increase than the rise in nurse educator salaries. LPN salaries have risen almost 26% in that time, RNs by 19%, CNAs by 29% almost. So there's a real issue here too with what nurse educators are being paid and the supply of RNs into the field. I'm highlighting this because there's issues within the sector that you can and can't control. This would be one that is difficult to control outside lobbying your state or the federal government to increase funding. And I saw recently that the Biden administration has released grants to educational institutions so that they can pay their nurse educators better. But digital nursing is something that you can't control. Even if you're within human resources and it's not necessarily your field, it's something that you can bring to leadership, highlighting the potential benefits to recruiting and retaining staff and providing care that it provides. I definitely put this in the category of something to investigate at the very least, because of the impressive results that ChristianaCare have generated. If you aren't sure where to start, or you'd like to talk a little bit more about how this could affect your nurse recruitment and retention, don't hesitate to reach out to me, Adam Chambers, on LinkedIn. Until then, I wish you all the best in fighting your nursing shortage. So thank you for watching, and I'll leave you with a little bit of an explainer about what we do here at Nurse Recruitment Experts. Thank you.